I'm Constable Dominique Vernon. I work in the Mental Health Support Unit at York Regional Police. I have a family member who suffers from a serious mental illness. That person suffered from addiction as well, and we do unfortunately deal with a lot of individuals who have mental illness along with substance abuse. And certainly I empathize with them because I've lived that experience, and I know how painful it can be to see someone you love experience addiction and mental illness.
So when our team arrives on scene, frontline officers have ensured that the scene is safe. We go in and we engage, and the officer with the team will explain their role and then introduce us as the crisis worker.
And again, we're there to support each other. They don't have police training, but obviously their training in mental health is superior. So they assist in a really important and meaningful way so that they can provide resources and also de-escalation of a person who's experiencing a mental health crisis.
We see people quite often in an escalated state. Part of our role is to help that individual come back down where they can hear and they can take information in and they can give information, because a lot of the times they're upset that they've been triggered by something or something has happened and they don't know how to convey that because they're in such a heightened state. So we just go in and we talk. We have that's our main tool, is we're able to talk.
Yeah, the uniform definitely can be intimidating, and it can be a trigger for some people. So a lot of people, unfortunately, have had negative experiences with police. Police aren't usually called for good things. And so when an officer arrives that isn't in uniform, it can really help to de-escalate a person who's experiencing a mental health crisis. And the uniform, the police cars, the marked police cars, and sometimes sirens can really escalate a person's behavior in those situations. So the fact that an officer from the mental health support team attends without a uniform, it can really assist in de-escalating a person's behavior. And the fact that we're with a civilian, someone who's not a police officer, who's obviously not wearing a uniform, that really helps as well. And sometimes people are immediately de-escalated just by our presence. Many of our calls, we do follow up with the person and the family that was the subject of the call that we had dealt with. So, for example, maybe there's a situation where a person was apprehended and it's an ongoing issue of behavior for the person in crisis. And if it's sort of an ongoing issue, then we do try to follow up with them in person. We also have a call diversion unit that also assists by placing phone calls to people after a call has taken place, just to check in on them and to see if they have accessed the resources that were offered, or to see if we can offer more resources to them.
We have men's shelters, women's shelters, violence against women shelters. We have drop-in centers. We have crisis beds. We have, which are specific for police. We have case management services. We have a ton of resources. We have within York Region Police's programs, we have the mental health engagement and outreach team, which is the MEOT team, and that is a team of an officer and a social worker that will do interventions and ongoing support for individuals that keep coming through the system, that need that extra bit of support. That there are folks that always seem to fall through the cracks, and MEOT is the team that helps bring them forward for services. Our team, our mental health support team, also is backed by a social worker behind the scenes who will review calls and follow up if they feel that there's something that's been missed, or other resources can be provided, or if this person has been hospitalized many times or has multiple police calls, they try to speak with either that individual or the family to see if there's anything else that can be provided. We have our call diversion unit, which will take live calls that come in from police calls, and they can provide on-the-phone support. But they have the ability to request police if the call escalates or the person escalates and there's risk of self-harm, suicide, or they just feel that something's not right. So we're able to do a wraparound service.
We have a lot of persons that unfortunately come into contact with police on a frequent basis due to their mental health issues, and providing them with resources prevents them from continuously having to be involved with police. And so the resources provided are helping them deal with their mental health concerns on an ongoing basis, hopefully in the long term, so that they don't have contact with police.
So I think the wraparound service is essential in these times, because you've got people that do fall through the cracks, and their needs are greater than some others. And if we're able to reach out and go that one extra step, I think it makes a difference. And I think that's why I'm proud to be part of York.